This page was created to teach Black history. Unfortunately, the American educational system was designed to exclude our real historical account, so we are here to dismantle it. It's time to enlighten those of us who have been kept in the dark. I am a Black man who didn't know enough about my own history, so I began to dig deeper and do my own research. Black history is American history, so I want people of all races and cultures to join together to learn our history as one. Here, I will share all of my findings. Please like, follow, share, and subscribe to Teaching Black History. The story of Daniel Hale Williams. Williams was born in 1856 and raised in the city of Hollidaysburg, Pennsylvania. His father, Daniel Hale Williams Jr., was the son of a Scottish woman and a black barber. His mother, Sarah Price, was African American. The fifth child born, Williams lived with his parents, a brother and 5 sisters. His family eventually moved to Maryland. Shortly after, when Williams was 9, his father died of tuberculosis. Williams' mother realized she could not manage the entire family and sent some of the children to live with relatives. Williams was apprenticed to a shoemaker in Baltimore, Maryland, but ran away to join his mother, who moved to Rockford, Illinois. He later moved to Egerton, Wisconsin, where he joined his sister and opened his own barber shop. After moving to nearby Janesville, Wisconsin, Williams became fascinated by the work of a local physician and decided to follow his path. He began working as an apprentice to Dr. Henry W. Palmer, studying with him for 2 years. In 1880, Williams entered Chicago Medical College, now known as Northwestern University Medical School. His education was funded by Mary Jane Richardson Jones, a prominent activist and leader of Chicago's Black community. After graduation from Northwestern in 1883, he opened his own medical office in Chicago, Illinois. When Williams graduated from what is today Northwestern University Medical School, he opened a private practice where his patients were white and black. Black doctors, however, were not allowed to work in America's private hospitals. As a result, in 1891, Williams founded the Providence Hospital, which also provided a training residency for doctors and training school for nurses in Chicago. This was established mostly for the benefit of African American residents to increase their accessibility to health care. But its staff and patients were integrated from the start. In 1893, Williams became the first African American on record to have successfully performed pericardium surgery to repair a wound. On July 10, 1893, Williams repaired the torn pericardium of a knife wound patient, James Cornish. Cornish, who was stabbed directly through the left fifth costal cartilage, had been admitted the previous night. Williams decided to operate the next morning in response to continued bleeding, cough, and pronounced symptoms of shock. He performed this surgery without the benefit of penicillin or blood transfusion. It was not reported until 1897. He undertook a second procedure to drain fluid about 50 days after the initial procedure. Cornish left the hospital. In 1893, during the administration of President Grover Cleveland, Williams was appointed Surgeon-in-Chief of Freedmen's Hospital in Washington, D.C., a post he held until 1898. That year, he married Alice Johnson, who was born in the city and graduated from Howard University and moved back to Chicago. Williams also established a training school for African American nurses at the facility. In 1897, he was appointed to the Illinois Department of Public Health, where he worked to raise medical and hospital standards. Williams was a professor of clinical surgery of Meharry Medical College in Nashville, Tennessee, and was an attending surgeon at Cook County Hospital in Chicago. He worked to create more hospitals that admitted African Americans. In 1895, he co-founded the National Medical Association for African American Doctors, and in 1913, he became a charter member and the only African American doctor in the American College of Surgeons. However, he died in relative obscurity. His retirement home was in Idlewild, Michigan, a black community. Williams died of a stroke in Michigan on August 4th, 1931.